A lot of the independent patient advocates are single person, one owner, one worker. But I, from the get-go, said, no, I'm going to do it different. And so it's been very rewarding to train nurses to become advocates.
Welcome to Nursing Beyond the Bedside. I'm Audrey, your host, and a nurse who pivoted my path several years ago. After 8 years as a critical care nurse, I was ready for change. I craved higher pay and more flexibility, but was struggling to find a clear path forward. Fast forward through positions in recruiting, customer success, and marketing, and many lessons learned along the way. Today, I run Pivot Path, a company dedicated to empowering nurses to redefine their careers. This podcast is designed to help you navigate the journey from clinical bedside nursing to a fulfilling career that aligns with your passions and goals. Here, you'll discover inspiring stories from nurses who've gone beyond the bedside, successfully transitioning to non-clinical roles, or redefining their nursing career. Join us as we hear their stories and share actionable strategies to help you make your own leap. Whether you're a new listener curious about what lies beyond the bedside, or a returning audience member in need of some fresh motivation, this podcast is your go-to resource for exploring new opportunities that can transform your career. Let's get started. Today, I'm excited to welcome Lori Schellenberg, a retired nurse and case manager who, after years of service at the bedside, felt called to continue giving back to her community. Lori is the founder of Stepping Stone Advocacy Services, where she helps patients and families navigate the often overwhelming healthcare system. In this episode, we'll dive into the world of patient advocacy and how Lori is building a platform to support and mentor nurses who are interested in pursuing a new path. Lori's vision is not only to guide nurses in their career pivots, but also to create a network of professionals who can pay it forward and mentor others. Welcome to the show, Lori.
Thank you. It's a pleasure to be here.
Yeah, absolutely. We have a lot of exciting stuff to talk about today, including, kind of how you are building a platform to help educate nurses and give them the tools and resources that they need to pursue a path in patient advocacy and pivot their career. So I know that that's where we want to get to, but I think it'd be helpful to start with a little bit of background on you and your nursing career so that we understand, where you're coming from.
Yeah, I think it's been quite the journey, but I'm so grateful for all the different things that happened to me in my career or didn't happen in my career, because it led me right here to where I am today. And it's like the best job I've ever done. So, I got married young, right out of nursing school, and had 4 children. And my husband's was a firefighter and did shift work. So right off the bat, I was already scheming and looking for ways to make nursing work for me and my family. So, I took advantage of the weekend alternative program when that first came out. Back in the day, you got paid, you worked 2 12-hour shifts on the weekend and you got paid for 40 hours. So I really jumped on that right away. Then as I gained experience in the hospital, then I went to, the float pool to still kind of stay where I could be flexible for my family, but continue to grow my career. I didn't want to give up my career. So I went from there to going to home health care because that worked for my kids at that time in preschool. And then I pivoted away to occupational health nursing from a lead, actually, from this home health organization. And I had no idea what I was getting into, but it actually was pivotal for me and learning about occupational health, growing an occupational program, and learning about workers' comp. Because when the plant closed down after 150 years, when I was working there, I was able to pivot to become a nurse case manager in workers' comp. I wasn't a certified nurse case manager, but I had the skill set of everything you needed to know to be a workers' comp case manager. And so the reason I'm going and explaining this to you is so that other nurses can understand and kind of can shake their head like you're doing, going, yep. So, from there, I was able to learn this new I was on the cutting edge when case management first started coming out as a new profession for nurses away from the bedside. So I was able to transition and learn from there, and then did that for a long time. And then as the kids got older, I decided I wanted to try something new again. And I looked at travel nursing because I just thought it was a really cool thing to do, and you could do it locally. So I actually pivoted. I interviewed with the recruiter, and the job was for a rehab liaison, nurse rehab liaison for an acute rehab hospital. So I told the recruiter, I said, Jonathan, I've never been a rehab liaison before. And he told me all the reasons why I could be a rehab liaison. He said, I want you to interview for this position. And so I did, and I got the position. It was a 3-month contract. It was a local travel. So actually it was kind of fun because it was within a 60-mile radius. So it's just far enough that I could go and stay during the week and come home on the weekends. And my kids were all in high school and into college at that point. So I could do that. And so I learned this new twofold. I learned to become a travel nurse and the ins and outs of everything that goes along with that, and was able to actually encourage my daughter, who is an occupational therapist, to go into travel OT after she graduated from nursing because of my experiences. So from there, from the rehab liaison position, they extended my contract, and then the contract was over. And I'm like, what am I going to do next? So you know what I did? I researched the acute rehab facilities that were closest to me. And I picked up the phone and I called the director of the liaison program and said, here's who I am. This is what I'm looking for. Could you use me? And from there, I got a PRN job being a rehab liaison for a hospital because I took advantage of pivoting to travel nursing. So fast forward, sorry, this is a long story, but it makes sense when we talk. So
go for it.
So fast forward, my daughter went through her OT and she became a traveler. Well, she had some issues right out of college with the traveling, and I actually was trying to mentor and support her in doing this. So I said, let me talk to your recruiter. I said, and so I got in touch with the recruiter and we talked, and we became she loved the nursing aspect, even though this was a therapy travel company. She loved the clinical aspect that I had, that I could see into the bigger picture of working with hospitals to put their therapists there. In any event, fast forward a few years later after that, she's at another company. We reconnected, and now I do nurse consulting work for her at this travel company where I kind of am on kind of a monthly retainer to support the nurses that are out there traveling when there is mediation that needs to go on between the facility and a nurse. Something's going on. And because I have the clinical expertise, which the travel company does not, they call me in to help. And that has been really rewarding. Keep going. I end up doing case management along with this, and I retired. My last job, I was like, okay, I'm done. I moved to Florida with my husband. He had been retired a couple of years. I'm done. Well, that lasted, what did I tell you? And I think about 2 weeks. And I'm like, I'm not really a bingo lady. What am I going to do? And I've always loved to mentor nurses because I always love to share my story and encourage nurses that you have no idea all the translatable skills you have. I said, and there's so many things out there. And so that was one of the things that was really important to me, is how can I continue to mentor nurses? And one of the ways was, continuing to do the travel support for nurses that are out traveling. And then the second, thing is I had learned about this new position, this profession of patient advocacy. And I was very intrigued. And I started to do research and ended up developing my own program and launching 2 years ago with a goal of I wanted to have a team around me from the beginning of nurses because I love that camaraderie and that sharing of the experiences and helping each other out. So a lot of independent patient advocates are a single person, one owner, one worker. But I, from the get-go, said, no, I'm going to do it different. And so it's been very rewarding to train nurses to become advocates. And the second part, so that was one of my goals, was mentoring and train nurses. And then the other one was to start a patient advocacy business to give back to the community, help patients and their families and their caregivers navigate the healthcare system. So I've had two goals. So that was 2 years ago. And here we are on this day. I'm getting ready to launch a platform within Stepping Stone Advocacy Services to support and mentor nurses that are ready for a change, that, want to do something else. And it doesn't mean that they're burnt out. Maybe they just, want to learn something new, or it may be a nurse that's in the end of her career that just kind of wants to slow down and work for somebody else and have a few files. Or there's people like me that retire and say, oh, I'm not ready to retire, and jump back in a different way. So that's how so my advocacy for patients, their families, and nurses is what this is all about.
Yeah. So you and I align very much on this idea that your career does not need to be static. Like, you don't need to force your life to fit into your career, and you can be creative with your career in order to have that, your career path shift and change and morph as your life does. Right. So you can see where you did that time and time again throughout your path to kind of make it work for whatever stage you and your family were in. And I think that is so important just to call out, because nurses, I think historically, we've thought oh, I'm a nurse, my job is at the bedside, and I need to do that for, the next 40 years in some capacity, Yeah. And so I think that it's amazing to highlight that that can look so different, your nursing career. For you were bedside, you did case management, you were a liaison, and now you've started your own business, which I think is just such a testament to the fact that nurses can do so much, we have value that can be applied in so many different ways. So just opening our eyes to opportunity beyond that clinical bedside position that is honestly usually a very important foundation for our career, that bedside experience. But I think it's important to realize that we can do so much more beyond that. And you're a perfect example of that.
Yes. Yes. And that's why I've said, mentoring my own 4 kids, about don't be stagnant, take your skills as you go along. And if you want to go in a different direction, that's fine. And so, that's just been part of my makeup, is that seeing the bigger picture and wanting to pay it forward, and wanting to pull other people, in our case, pull other nurses up and say, no, nursing is a wonderful career. Whenever I hear people say, I don't want to be a nurse anymore, I don't want to, it kind of just saddens me, because we have so many skills to use in so many different ways. So
let's break down a little bit kind of what that workers' comp case management role is. And then let's talk about the same with patient advocacy, because I think that both of these things are roles that nurses might have some conceptual awareness of without fully understanding the nitty-gritty of what those jobs actually entail. Yeah. So starting with the workers' comp case management, how would you describe that job and the roles and responsibilities that you're dealing with every day?
So I think you first have to look at who you're working for when you're a patient advocate versus who you're working for as a nurse case manager in workers' comp. Both roles, you act as a patient advocate. As a patient advocate, you're helping the patient to navigate the healthcare system. You're helping them with so many things in navigating the healthcare system, working in transitions of care. It could be working in insurance, helping patients to figure out questionable insurance billing. It could be there's so many of us out there doing our own little niches now in patient advocacy, which I love too, because I can't possibly know everything, but I can go to another nurse patient advocate and say, hey, I know this is your specialty. Can you help on this case? But anyway, so when you're a workers' comp nurse case manager, you get assigned a patient who has had an injury on the job. And you are usually, that patient is referred to a case management company if you are working for a case management company, or it's assigned to you if you have your own independent nurse case management business. So there's, like you said, there's a lot of similarities there. With being a workers' comp case manager, you are working between a physician, the employer, and the insurance company. So you have a split allegiance in a way. You really are working for the patient. Your goal is to be that, because the insurance companies, they're not the medical piece. The employer is not the medical piece, and they need somebody to help these people that get injured. So in that respect, we are, but there are a lot of navigating. The same when you're a patient advocate, knowing all the players, understanding all the players, and how to navigate around that to get the best care for that patient, whether it's a regular patient or if it's a patient that was injured on the job. So it's very, very similar. And that's why it was a natural thing for me to say, this is another avenue for nurses that I want to introduce, because workers' comp case management is it's a niche. And it's really hard because a lot of the case management companies want to hire you if you have experience. Now, a lot of us are aging. A lot of us that are workers' comp case managers, we started back in the 90s when everybody was learning at the same time. CMSA, was becoming big and getting certified becoming known as a profession in case management. But then this is like not a hospital case manager. This is something unique. So understanding how, and with the ultimate goal of getting a patient better, back to their baseline, and getting them back working. That's your goal. Same goal, patient advocacy, in that our goal is to help patients and their families get better. What I mean by get better from the family perspective is we get a call when they are just frustrated, they're burnt out, they're scared, they don't know where to turn, they don't know how to navigate the healthcare system, so they call us. Same on the other side, we get a call because the workers' comp insurance company needs help to navigate through all the providers, if they need specialists, coordinating care for that patient. But it's a unique thing because you have to understand all about the law, workers' comp law, return to work, how it all plays together. So each of them are nuances. Workers' comp, it's hard to get a job in the field, but we need new nurses to come up. And a lot of times you either love workers' comp case management or you hate it.
Both of these roles, you are really getting to be there for your patient. Yeah. And you get to look out for them, which, if I remember from our last conversation, something that you really enjoyed about your nursing roles was building those relationships with patients and families. And so I think that, both of these paths that nurses could take, particularly with the being a patient advocate, I think is for the nurses who really love that part of nursing, but feel like they are overburdened in the current healthcare environment and they don't have enough time to really, educate their patients properly and spend that time with them. The continuity, once a patient leaves your unit, you never really hear from them again or know what happens. So getting that continuity with, the patient and their family is really neat. And, you're so right that like the healthcare system is so complex right now that it is, it is so powerful to have a nurse on your side as that patient or family, especially if no one in the family like knows healthcare and has worked within it, because it's so easy to get lost in our healthcare system. And it's not that the people working within the system like have any poor intention. It's just a very complex system, especially when you're trying to like work between providers and have medical records transferred and all pulled back together for another provider to complete a procedure. Like it can get very messy. So having that nurse voice on the other side to help guide you through that, I think is just so important. And I think it's also, I wanted to call out, I think that it's worth calling out that in the hospital, nurses hear patient advocate and they were like, oh no, a patient or a family wants to complain about me, and that patient advocate works for the hospital and they come to like basically do service recovery with that patient or their family. And I think that that is what a lot of nurses think when we hear, oh, patient advocate. And so I think that it's an important call out that what you're doing is like you are privately hired by patients and their families to really be on their team and help guide them start to finish through like a health event or, a longer term journey.
We call that in the patient advocacy industry, the allegiance factor. And it's really important. And I think that's just one of the takeaways to remember if you're out there listening and you're not a nurse or you're wanting to hear more about how to become a patient advocate and why it's such a great field for nurses, is because when we are hired privately, our allegiance is to the patient and their family because they're paying us to do the service. And it's important to remember that there are patient advocates out there that are in a healthcare setting. They work for hospitals. I have had many experiences with trying to get things fixed or help me to navigate within the system when I was taking care of my dad before he passed. And I began to see a pattern as I was at different hospitals trying to advocate for him. And I don't know if it's changed because I haven't used one in a while, but when I was actively trying to navigate the healthcare system for my dad, they would listen. I would come in there often with a box of Kleenex in my hand, in tears or so mad or so upset. And I wanted a resolution. I needed them to listen, but I also wanted resolution. I thought that's what patient advocates strove to do, which is what we do. But it was always the same. Took all the information, nodded a lot, listened, held my hand. I thought, okay, somebody's finally listening. Somebody's finally hearing me. And then inevitably 2 weeks later, 3 weeks later, I get an email that says, we've looked into your situation and it appears that they did everything according to, what should have happened or whatever. So I never got resolution. So that was a driving factor when I decided to become a patient advocate, was fighting for my dad. It was like creating this because of my dad. And that's why I do it.
Yeah. Yeah. Nothing like a personal experience to really hit close enough to home and fuel your passion to make things right and do things better. So it's neat to see what you've done with it. Let's talk some then about like nurses who might be interested in pursuing patient advocacy as a path. They're listening to this podcast and they think, like these are aspects of nursing that I really enjoy and I just don't have time for in my current position, unfortunately. And they're interested in kind of like pursuing this. How can they get involved with learning how to be a patient advocate?
I actually have a nurse patient advocate working with me now that she works in the ICU, and she answered an ad for me wanting to know more, because she said, I want to know what happens to patients and how can I do a better job with families in the hospital. And I can't do that if I don't understand what happens when they go home, and how can I work with patient advocates in the ICU? She even said, and I explained, she's been doing a wonderful job with me because she's able to help patients transition in their care. She has that translatable skill. She understands the medical piece of it so well. And now she's seeing the other part of, I arranged with the discharge planner for home health and sent him out the door. I thought everything was good. And she said, now I see where, you hand that off to the discharge planner who hands it off to the family. And then the home health people don't call and they have a problem. And then they call the hospital and, your chart's not even here anymore. We can't look it up if you call back to the unit. So, when you have someone overseeing a transition in care, it's very helpful to the family. And I often get the question, well, why do I need a patient advocate? I have the nurse that's helping me in the ICU. I have a nurse case manager that's helping me with my discharge plan. And now I've got home health set up, or I'm going to transfer to skilled nursing for rehab for 2 weeks. Everything's set up. Why do I need a patient advocate? Well, what happens is the ball gets dropped. And if you don't have somebody that is the quarterback for you, that has all the information, everything that needs to happen, knows what the goals are, understands where you are in PT and what needs to happen in rehab, or what needs to happen and why they need PT and OT in the home, things get lost. And that's when family members get so stressed. My dad needs pain medication, and it's not, they never gave us a prescription for now, and it's Friday night. And, just all those kind of things. And it's funny because my nurse advocate that works in ICU, she said, it really makes me take just a minute more to say, if this happens, then because she knows now. And she said, I just love being a patient advocate because it's taking everything and it's helping families. So.
Yeah. And I mean, for so many of us, that's what we like, that's what makes us feel so fulfilled about being a nurse, is like really making that difference, being that positive impact, and like creating a better experience through a really like otherwise very stressful time. So it's cool to be able to like really be able to focus on that without a lot of the like extra noise and distractions and pressures that we're often dealing with, when we're on the unit and have a full patient load. And we've talked some too about like, so you have your curriculum that trains nurses to be patient advocates, but then you also have this education platform, which I personally find it really exciting that you educate on the thing that you're an expert at, but then you have these other experts come in and provide their niche knowledge to the nurses in your program as well.
Yes. And that's what I think is different. I work with AFA, the Alliance of Professional Health Advocates, and I'm very, I support them. I'm a member, and I also do a preceptorship for them but it's not just for nurses, because anybody can become a patient advocate. But, going forward with my original mission was to advocate for patients, families, and nurses. So that is why this vision now on my platform, to talk with nurses and to educate them as nurses. But also, I wanted a chance. So many people helped me when I started my business. My neighbor that is an expert in Google business profiling, how to set that up, how to do that, then recommended me to a website designer who worked with me, who then recommended me to a CPA. Like, I had this whole network of people that supported me. And I just had this aha moment where I'm like, you know what? I can we can go through each program that I teach and I can go through business step by step, when really, why don't I ask the experts to come in, do a 30-minute presentation, hour, whatever they think would help my nurses for whatever particular skill they need on the business side of whatever it is that they want to do, because this is all about being able to advocate. I also am inviting nurses that have done what I've done in different ways to be able to come in and be an instructor for me, introduce what they're doing, pay it forward for other nurses, and also for them to get a little bit of passive income on my site too. So I'm really trying to help the people that, help me, all those people, but also the nurses that have been successful, to promote them. And then also my patient advocacy work on the side. So it's kind of a big thing. And it's been 2 years kind of in the making, as I've I set these goals, but I didn't know how I was going to do it. So everything else just kind of happened.
Yeah. That's usually how it goes. And I think that that's what's so great about your education platform as well, is like, if I'm a nurse who's leaving the bedside and I'm like, okay, I want to be a patient advocate. That means having my own business. Lori can teach me how to be a patient advocate, but like, you think about starting your own business and like getting a customer and like working with them. And on one hand, it might sound kind of easy until you start thinking about like all of the different pieces that like have to happen between like, deciding you're going to do this thing to actually securing like your first customer, and then like either retaining that customer or like continuing to pull in more customers. It can feel kind of overwhelming. And so the fact that, through your platform, you have resources for them for like each puzzle piece, I think is really fantastic. And it really sets them up for success. And I love that it's a kind of a network of mentors, right? Like in nursing, sometimes we can get a bad reputation for eating our young. And this is such the opposite of that, which is so fantastic and just sets such a good precedent. Building that network of nurses supporting nurses, I think, is really incredible. And yeah, I'd encourage nurses who are listening today to check it out and, see what they can learn.
Like, I feel like I felt the day I turned on the lights in 2022, and I feel that excitement and in that, like, that being a little bit of afraid and are other people is this gonna resonate with other nurses? That whole thing. And I hope that we're able to we're going to be able to maintain the nurses in our workforce, maybe not in the same way at the bedside, but all the expertise and knowledge that patients and families need, and society needs in many different ways, not just, as a patient advocate. But
yeah, I think, some key takeaways for the nurses listening are maybe that, your career doesn't have to look the same for your entire career, right? Like, you can be creative with your career and make sure that you're still able to have a career and be passionate about your career, but also like really optimize your life for what's most important to you for that chapter that you're in. And, recognizing that can and will change as life evolves. And yeah, I think, just being brave and, exploring those new opportunities, exploring what's out there, and then connecting with people like, yourself and I to, figure out how to actually take those first steps. Cause I think that sometimes those first steps can be the hardest while you're really just trying to get some momentum going in a new direction.
And, it's interesting because I've been contacted a lot, people asking questions. On LinkedIn's a great place to network for us nurses. And, I get the question of, I want to do this. I've done other things. I should be able to do this. And I'd say, well, go on and look at AFA, join the conversations there. And then so they do. And then I'm like, there's a course there that, you could take. And then it's so funny because I think a lot of times people want to do things, but they need to be held accountable to move through the process. And I think by having these training modules and the extra education that they need, hopefully, they can make it through to the other side and actually attain the goals that they want to attain.
To learn more about Lori and her program, you can visit www.steppingstoneadvocacy.com, or you can contact Lori directly by email at lorischellenbergrn@gmail.com. Thanks for tuning in. Don't forget to hit subscribe to keep up with our latest episodes. And if you were inspired by today's conversation, I hope you'll share this episode with someone who'd love it just as much as you did. If you're ready to pivot your path, sign up for my free newsletter at mypivotpath.com. Get non-bedside jobs delivered to your inbox every week. And if you have questions or just want to say hi, feel free to email me at audrey@mypivotpath.com. Thanks for listening, and until next time.